Hi, and welcome back to the Hippie Martha Hormone Hour. I'm Ashley, your host and go-to person for helping you understand your body in a way that actually makes sense. Around here, we talk about cycles, hormones, and reconnecting to your body through using body literacy. But today's conversation is going actually a little deeper. After a reel that had over 5,000 views on my Instagram platform, where I posted, "Can we stop yanking babies from their mother's wombs?" signed a tired and frustrated birth doula. It sparked some private conversations with people, and so I wanted to share some information about what I meant by that post. First, it was not a slam to all providers. It was a frustration that I think many doulas, patient health advocates, bedside nurses, and educators share when trying to help clients or patients avoid unnecessary harm. In my own words, for Pete's sake, just leave the woman alone so that she can birth her baby. Becoming a mother, or as it has been coined, matrescence, is a special and initiating time in one's life, and adding unnecessary fear, injury, or insult to the equation is just not necessary. But often this is what I hear from mothers over and over again. Let me tell you, you know your body best. And if you don't, I highly encourage you to get to know her better by understanding what body literacy is and how to implement listening to what your body is saying. Because understanding your body doesn't just stop at ovulation, your period, or even pregnancy. It shows up in how you go through these life experiences and the way you are cared for in those specific moments. And this is something I've been sitting on for a while. I've stood beside thousands of bedsides watching women give birth, and though I'm not fully in the birth world anymore, what I'm seeing still happening to women during normal deliveries needs to be talked about. Today's conversation is a little outside my usual cycle and hormone topics, but it's one I feel incredibly passionate about. If you didn't know, I've been a birth worker for over 11 years. I've spent 9 as a labor and delivery nurse in the hospital and about 2.5 years as a home RN birth assistant. These days, I've stepped away from full-time birth work, and now I only attend births for close friends and family so I can focus on growing this space, teaching, educating, and supporting women in their health and hormones. And I want to pause here for a second and put language to what we're actually going to be talking about, and to also give a trigger warning. We are going to be discussing birth trauma, obstetric violence, and really be talking about the birth culture in the hospital. And so I want to just kind of put that out there first for you. So if this is a place where you need to pause, if it's too fresh, if it's something that you've experienced and can't listen to right now, I want you to just stop this podcast and go ahead and find another episode that might be suitable for you. But if you're still here, there is a definition for what we're going to be talking about. And according to the International Confederation of Midwives, obstetric violence refers to the mistreatment of women during childbirth. And that can look like physical force or unnecessary intervention, loss of autonomy, procedures done without informed consent, being ignored when asking for help, and being spoken to in a way that is shaming, threatening, or dismissive. It can also include things like non-evidence-based practices, or simply not being given access to physiological, hands-off birth when it is safe to do so. And what's important to understand is that it isn't just about someone having a bad experience. This is real, measurable impact. Obstetric violence has been associated with birth trauma, postpartum depression, PTSD, negative effects on intimacy and sexuality, increased risk of complications, and even a deep distrust in the healthcare system, to the point where some women avoid seeking care altogether in the future. And this isn't just about individual providers either. This is systemic. It is influenced by how providers are trained, hospital policies and hierarchy, time, pressure, and staffing shortages, and deeply ingrained beliefs about women's body and their ability to make decisions. And it disproportionately affects marginalized women, especially Black, Indigenous, and any women of color, because of the systemic bias within the healthcare system. And I think this is the part that's really important to sit with, because what I'm describing from my own experience in birth rooms is not isolated. It's part of a much bigger pattern. Some studies and sites that I pulled this information from so that if you're interested in learning more for yourself, it will be in the show notes. So when I say that this is happening every single day in birth rooms, I'm not being dramatic. But here's the thing. I've seen a lot, and I want to be really honest. I have also been part of the problem at times because of the system and how I was trained. When I first started in labor and delivery over a decade ago, physiological birth was almost a foreign concept in the hospital. Women who came in after a failed home birth, they were talked about like cautionary stories. Home birth in general was labeled dangerous. Midwives were few, heavily restricted, and working under physicians. And if a woman wanted an unmedicated natural birth, she was often seen as unrealistic. I know that because I was one of those women. 15 years ago with my first baby, I had one of the few midwives allowed at the hospital that I was delivering at. But I truly think, had I not had her on my side, I would have gotten a C-section. Fast forward to today. We've come a long way in conversation, but in practice, many providers are still operating from a medicalized model of birth, not a physiological one. So what does that actually look like? It looks like constant hands-on involvement, frequent cervical checks, touching, poking, and prodding of the perineum, and even micromanaging, even when things are progressing normally. And here's the truth. In most low-risk births, the body already knows what to do. Yes, there are absolute moments where intervention is necessary, but those moments are far and more rare than what we are seeing in everyday hospital birth culture. And I say this as someone who has stood in both worlds. I've witnessed birth from a medical lens, and I've witnessed birth when the body is trusted. And I will tell you, I have fully shifted towards a hands-off physiological approach when I am supporting my patients. So why am I talking about this now? Because in the past few years, the majority of births I have attended in the hospital have involved unnecessary, excessive hands-on care. And it's not what these mothers wanted. Most of the women I support are first-time moms. They bring me in for safety, advocacy, and support. And in those moments, I speak up. I have had to request no residence. I have had to put my body between patient and physician. I have also verbally stated desires of the patient and asked in moments, can we pause? Let's wait for the next contraction. She doesn't want to be touched. Please remove your hands. And sometimes they still don't listen. Even when the patient says it herself, even when it's been clearly communicated. And more often than not, this is happening with residents, providers who are still learning, but learning patterns that shouldn't be normalized in the first place. And this isn't just frustrating, it's harmful. Unnecessary cervical checks, repeated internal exams without clear reason, aggressive stretching of the perineum, hands constantly on the baby's head before the body is ready, tugging or pulling the baby out when there is no contraction behind it to help. This all leads to tissue damage, tearing, scar formation, and for the baby, excessive manipulation, traction, pressure. I personally witnessed injuries including torticollis, nursing disruptions, nerve damage, and even a broken collarbone. And I need to be very clear here. This is not about emergencies. There are absolutely moments where intervention is life-saving, whether that's the mother or the baby when situations change. That is not what I'm talking about here. I am talking about normal, progressing births where the body is doing its job and we interfere anyway. And here's where this gets bigger than just what I've seen. This is actually supported in research. There is a growing body of evidence showing that disrespect and non-consented care during childbirth is happening globally. We're talking about non-consented procedures, physical manipulation, ignoring patient voice, lack of respect for autonomy, medical gaslighting, obstetric violence. And this isn't rare. Many women report experiencing at least one form of this during their own birth. And the impact, it doesn't just end when the baby is born. These experiences have directly been linked to, like I've said, postpartum depression, breastfeeding issues, emotional trauma, and long-term distress around birth and healthcare. So when I say this matters, it really matters. And we also need to talk about something that is deeply ingrained in our medical culture. The quote, healthy mom, healthy baby, that's all that matters, isn't truly what all that matters. But here's the truth. The mom isn't always okay. And we don't always talk about that enough. A woman can walk away with a good outcome on paper and still feel violated, dismissed, or traumatized. Because satisfaction in birth isn't just about survival. It's about being heard, being respected, and having autonomy in your body. And honestly, I wish more residents and physicians were required to go back and watch their own births they attended. I wish they could sit down and rewatch the footage and ask themselves, did I have consent? Did I interrupt something that didn't need to be interrupted? Did I listen to the patient? Because what I see right now is a system that prioritizes being right over being reflective. And birth is not a place where ego belongs. We should be teaching providers how to receive feedback, take criticism, and improve their approach. Because this isn't just about skill. This is about how we treat people in one of the most vulnerable moments of their lives. Now, let's talk about what you can actually do, because I don't want this to feel disempowering. I want you to walk away informed and prepared. First, I need you to be clear about what you want, and you need to start early. If you don't know what you want, this is your job to explore that. I have some really good book recommendations in my resource library on my website at thehippiemartha.com. And I'm sure that most midwives or doula offices will have plenty of resources for you as well. When searching for a provider, or really an office, because most providers have other people that will be providing and be on call. So if you have one provider in mind, remember that that provider most likely isn't going to be taking care of you at the time of delivery. So you really need to look at the practice as a whole. You need to ask what model of care they provide. And is it one that aligns with yours? At your prenatal appointments, say it directly. I really am looking for a physiological hands-off birth, if that's what you're looking for. I want minimal cervical checks. I want to follow my body. I don't want any unnecessary touching or grabbing. And you can even say, I want to be the only one to touch my baby as they are born. Now, these are all things are progressing normally, and of course, emergencies aren't arising. Second, you can have someone with you who goes with you to your appointments or who is with you at the time of delivery. Now, this is where making sure that your person that you have with you can advocate for you and they know what they're talking about. This includes doulas, parents, spouses, significant others, life partners, whoever it is. You need to start having these conversations before you even enter that hospital room. And, we talk about hospital birth plans. Instead of doing a birth plan, I recommend that you think over what truly matters for you during labor and delivery. Because during labor, your brain shifts. You are going to be focused inward. You may not be able to speak clearly or push back. It can get really, really intense towards the end when delivery is happening. So this is where your partner, your doula, your support person, whoever it is, they need to know your wishes and be ready to enforce them if it is safe for that time. And third, you need to know your rights. This is the part that many women don't realize. If something happens that you did not consent to, you can report it. You can ask for it to be documented in your chart. And this goes for all visits as well as labor and delivery, and even in the postpartum phase. You need to clearly state that you did not consent and that you would like to file a formal complaint. And if harm occurred, there are legal options. And this matters beyond just your experience, because when this behavior goes unreported, it continues. And research shows that when women experience disrespect in birth, they are less likely to seek care in the future. That affects long-term health and safety. Now, I also want to say this. There are incredible providers out there. There are doctors and midwives who deeply respect physiological birth, but it can be hard to find them. Asking questions like, what does a typical birth look like for you? What type of interventions do you usually do with the majority of your patients? How do you support physiological birth? And listen carefully, not just to what they say, but how they say it. Because birth Yes, it is big business, but it is also one of the most important, vulnerable, and transformative experiences of your life. And you deserve to feel safe, respected, and in control of your body. Now, I'm not here to scare you. I'm here to help you see clearly because this is happening and it doesn't have to be your story. If you're trying to get pregnant, preparing for pregnancy, navigating your cycle, or wanting to feel more confident in your body and your choices, I support and can be an advocate for you by teaching you how to understand your body and in return, empower you to advocate for yourself. My goal is to speak out about what I have seen in the labor and delivery world and to just put more awareness so that you can have a more positive experience and really having collaborative care with your providers so that they really understand what you truly want is most important. I hope this created some clarity for you. And if you have more questions or if you're trying to get pregnant, preparing for pregnancy, navigating your cycle, or really just want to feel more confident in your body and your choices, I can support you. I have been a patient advocate for almost now 20 years. And my goal is to be able to provide you with education and an understanding on how to advocate for yourself, especially in situations that you might not be familiar with. If you have more questions and are looking for support, feel free to book a free discovery call so that we can chat more and see if my services or my information will be of help to you. Because this work doesn't start in labor. It starts with your own connection to your body. All right, we're going to end there. Thank you so much for listening. Until next time, we'll see you soon.